Dental implants are a replacement of a tooth, the best way to replace a natural tooth that's been lost, that allows for the bone to be supported and actually produces a replica, essentially, of a natural tooth that we no longer have. And in fact, the implants, they biointegrate within the bone and actually form an intricate connection to the bone where, in a sense, an implant is actually stronger in the tooth in a lot of ways. If we place this implant in the bone and it fully integrates and then build a crown on top of that, and the tooth is actually now stronger than before, it would be really, really critical, right, to put it in the right place. Otherwise, we really can't do too much about it. We can't move it, so an implant does not move, so we can't move it like any other tooth, and we can't fix it later because it literally becomes part of the bone. Biointegration is the strongest way that we have for tissues to become essentially one. So at that point, we can't fix it. We can't have it wrong at all. So the best way to do that is to make sure that everything is actually precisely engineered for success from the start. Like, begin with the end in mind is just a good practice in general in life. Having the periodontist on site and having myself as a rehabilitative dentist to be managing the whole care of the process and to be able to provide this ideal outcome, we use what's called guided surgery. And the way that we do that is we actually take an image, which is called a CBCT scan. So that is a three-dimensional image of all the structures of the bone, the teeth, the opposing teeth, everything, nerves, everything that's there. And again, there's potential risk of damaging a nerve when we place an implant. So to make sure that everything is taken into consideration, we take that CBCT scan. Then we actually digitally design where the crown of the tooth, the part that you see in your mouth, goes. So we know exactly where this actual tooth is going, because last thing you want is to place an implant in the bone and we can't actually build the appropriate crown. That would be just a complete disaster, right, as you can imagine. And that actually does happen quite often. And then we use that CBCT image where we design the crown, and first we place the root now up underneath that to be able to support the crown that we're actually trying to create in the most safe way possible, where we're not damaging the nerves. We're placing it in the strongest part of the bone for biointegration to occur and be successful, and for the implant to actually work to support the crown, which is really the end state, and that is the whole reason why we're placing an implant, to put it in the right place. Guided surgery is the best way to provide the most ideal outcome, and this is how we engineer success from the start. Work with a specialist, periodontist, a surgeon, to do the actual surgery. Myself, design everything and manage everything, and use technology like CBCT scan and guided surgery to be able to design everything, engineer everything. And that also allows us to be able to do what's called a surgical guide. So we actually 3D print a surgical guide with a specific location to where the implant goes and place it exactly where it needs to go to support the ideal crown. So that is how we engineer success and have great results and amazing patient experiences.